So let's talk about breast implant illness
Mhm.
because that's the word. And it depends on how you ask what it is. What is breast implant illness?
Yeah, for me, it's a chronic inflammatory process. And that's why when you take out implants, which are sitting here on the table, you'll find similar patients across a broad spectrum that have very similar symptoms. And that's why I think if you sit in front of a practitioner and you rattle off all the symptoms, which I mean, it's a pretty long list,
Mhm.
it's confusing.
Right.
And then you may get tagged with an autoimmune diagnosis. You may get tagged with anxiety or depression,
Menopause.
menopause,
Mhm.
fibromyalgia, Sjogren, whatever. I mean, there's just like
Yes. Mhm.
everything possible. And if you don't have that red swollen breast, somebody thinks it's a breast implant
Mhm.
infection. Sometimes they don't even tell their practitioners they have implants.
Right.
So it's a little hard, I think. If it wasn't for this patient or my history of dealing with cancer patients and implant problems, you know, I probably wouldn't be as curious about that. And then that patient clearly put me on a Facebook group, and then I just had people start calling me about explant surgery. So it's taken 7 years and a lot of reverse engineering to work out many of the problems. Um, but when you have chronic inflammation, it can affect every system. So you may have brain fog and light sensitivity and sound sensitivity and dry eyes and a cough and nasal congestion
Good.
and difficulty swallowing and shortness of breath and chest tightness, pressure, a racing, heartbeat. You can have pain in your arms and legs. It can be, tingling. It can be like pins and needles. It can be vibratory. You can have intractable just think of things like UTIs and vaginosis, and I've had people with proctitis, athlete's foot. I mean, you name some weird thing. I've had somebody show up with these crazy full body rashes, cystic acne. I mean, I
Yeah.
don't,
It goes on.
I'm just naming